I'm tired of getting up and going to work. I'm tired of my coworkers. I'm tired of being here. Like, I'm stressed out. Hi everybody, welcome back to the channel. My name is Joy. I'm a nurse practitioner living here in Houston. I make content about nursing, living here in Houston, and how to achieve your goals. If that sounds like something you're interested in, go ahead and push that subscribe button and let's get into the content. Today's content is going to be about nurse burnout. Everybody experienced nurse burnout. If you're a nurse and you've been a nurse more than 2 years, you've experienced nurse burnout. As nurses, we are problem solvers. And sometimes we'll know that we are experiencing burnout and we will literally just like deny it. We won't tell anybody about it. We'll just keep it to ourselves. We'll start to feel overwhelmed. We'll get exhausted. We'll hate going to work and we won't do anything about it. So in this video, I'm just going to talk to you about it, my experience, and what you can do to avoid it. Okay, so number one, I'm going to say that you have to prioritize yourself. I know that nursing is supposed to be like this selfless job, you know, oh, I'm doing it for the people, but you also have to take care of yourself. If you're not taking care of yourself, you can't take care of your patients. Even in the airplane, they tell you, like, if the plane is going down, put the mask on yourself first before you help anybody else. And that's exactly what you have to do. You have to prioritize yourself in nursing, especially when you start to feel burnout. You have to make time to recharge. I'm talking about even if it's like Pilates, you know, going to the gym, whatever you do, watching your favorite show. I mean, sometimes I literally just stay in my bed. I stay in my bed all day in my pajamas, and that's my happy place. I love my bed. So whatever works for you, that's what you have to do. Sometimes we just work so many shifts. Like sometimes we'll just pick up overtime after overtime over overtime, and we're not really paying attention to what's that doing to our bodies. Like, you know, yeah, it's nice to get that money. Yes, it's nice that we're able to just pick up shifts like that, but what cost? You know, what is the cost? It's taking a toll on your body picking up those shifts. And I get it, like sometimes the unit is so short staffed and you just want to be helpful. You want to be helpful to your coworkers, but you have to prioritize yourself. You can't just take care of everybody and not take care of yourself. You have to make sure that you're eating healthy. Like if you are picking up these extra shifts, you should meal prep or you should have some healthy food like to take to lunch, because y'all know in those cafeterias that food is fried. Everything is fried. Nothing is healthy, especially if you work nights. So it's just important to make sure you're being mindful about those things and you're taking care of your health that way as well. Remember, you can't pour into a cup if your cup is empty, okay? Like I remember working shifts. Like I would work, I think probably the most I worked was 9 shifts in a row. I would say towards the 5th day, my attitude is bad. I don't want to go to work. I'm tired. I look crazy because I literally just been working, eating fried food, going to sleep, getting up, working again, like just not taking care of myself. And now that I'm 40, I'm like, I'm not doing that. Like that's just not my life. I'm not gonna live like that, you know? So you have to make a decision to not do that to yourself. You know when you're getting exhausted, you know when you're getting overwhelmed. Like slow down on picking up the extra shifts. Set boundaries. Like, yeah, you feel guilty for saying no, but you have to say no. Like, just say no. You can help as much as you want to help, and you can pick up all these extra shifts because you're trying to do something, but remember the cost. You have to remember the cost. Setting boundaries is not about being selfish. Once you learn that word no, once I learn no, I say no all the time. Okay, like recently, my coworker asked me to cover a shift. I'm a new grad. I'm still kind of, you know, worried about working too many hours. So I'm like, I can't do that. Because, you know, we work 24-hour shifts. So if I stay over, I can stay for 36 or 48 or 72. I can stay to 72. I can't stay to 72. I'm not there yet. I don't think I'll ever be there. Like, I just want to go home. At the end of that 24-hour shift, I have enough energy to get in my car and to drive the hour to get back home. The thought of staying for 48 hours is just insane to me. I can't do it. So I said no. And you have to be an advocate for yourself. When I told her no, guess what she said? I understand. Nobody judged me for it. Nobody was upset with me. Like nobody was thinking you need to work these shifts. She understood. So advocate for yourself and learn the word no. The next tip is that you want to build a support system. If you have a nurse mentor, somebody on the unit who's your friend that you can talk to, that you trust, I would say go to them and talk to them about how you're feeling, because 9 times out of 10, they already been through it and they have tips to give you. They understand how you feel. So talk to them. You know, I'm big on therapy. So if you can get in therapy, if you have health insurance, you can get in therapy. And if you don't have health insurance, you need to figure out how you can get in therapy. If you're a nurse, you probably have health insurance, so you need to figure out how you can get in therapy, find you a therapist, and talk to them and let them know kind of how you feel, because they can give you the tools to get through this situation. One thing I always say is it doesn't rain forever. The sun eventually does have to come out. So if you're feeling depressed, if you're feeling sad, if you feel like you hate your job, you're feeling overwhelmed, you can talk through that with therapy or with a coworker that you trust. You know, nobody wants to go to work and just vent and be like the negative Nancy on the unit. I got all these bad things to say about my job. Nobody wants that. So find you somebody who you can trust where there's no judgment. Tip 4 is going to be, you gotta find the joy. Like, you gotta find the joy. So instead of being worried about all the negative, focus on all the negative. Like, I'm tired of getting up and going to work. I'm tired of my coworkers. I'm tired of being here. I'm stressed out. Focus on the good things. If I'm tired on my way into work, I always say, I'm so thankful for my job because I work 7 days a month. I'm so thankful for my job because I can travel. Not, oh, I gotta work this 24-hour shift. I'm thankful for the 24-hour shift because I work 7 days a month. I'm thankful for the 24-hour shift because it gives me the opportunity to travel. You know, yes, my job is stressful, but look how much I grow. Yes, my job is stressful, but look how many lives I touch. Try to focus on the good. Try to find something that makes you happy and inspired to go to work. Yeah, my job is scary. But man, when the baby gets to go home, like, there's no feeling like it, knowing that you played a part in that. You gotta work on Christmas, put on your Christmas sweater. Go to work, give everybody candy canes. Like, try to find some type of joy. That's gonna make your day so much better. Where your attention goes, your energy flows. So if you focusing on the negative, your energy is negative. If you're focusing on the positive, your energy is positive. This is all mindful practice on how to be happy and how to be grateful and how to practice gratitude instead of just focusing on the negative. Just try to shift your perspective and stop picking up overtime, and you will see how much of a difference that will really make for you. Okay, the next tip is going to be to stay organized. Get a planner. Get yourself together. Like, plan out your shifts. Like, you know, you're going to work on Monday, Tuesday, Wednesday. Have your planner, know that. So then, okay, I know I gotta work Monday, Tuesday, Wednesday. What day am I gonna clean my house? What day am I going to meal prep? You know, have that all in line so that it makes sense. If you're working Monday, Tuesday, Wednesday, maybe on Sunday, you clean your house, you meal prep, you get ready for the week. So then your entire shifts, your entire 3 shifts is perfect. Like, go seamless. Try to be organized. And listen, if you can't be organized, outsource the work. If you can't cook, you need to get a meal prep service. Like, they have, what is it, Factor? Get Factor. And then they can deliver the food to your house, and then you can have it. You don't have to pay for the entire thing. Just get enough for your shifts. Get enough for 3 days. That way you know you're eating healthy while you're working. If you can't do the laundry, outsource the laundry. Have somebody do the laundry for you. If you know you're not going to get your house clean, have a cleaner come earlier in the week so that your house is clean while you're working. It's nothing like coming home to a clean house after you don't work 12-hour shifts. Like, nobody wants to come home to a junky house. Nobody wants to come home to dishes and stuff. So if you don't have time to do it, outsource the work. It's not that much more expensive, and you're already working extra anyway, so pay for the convenience. You have to be high maintenance to be low maintenance. I haven't been in a grocery store, and I couldn't tell you how long to actually grocery shop. I go into a grocery store if I need to just run in and grab something really quick, but I'm not going in there and grocery shopping. You know, my groceries been getting delivered for years now. So I'm willing to pay for that. That's a luxury I'm willing to pay for, because I don't want to spend my time. I used to be so stressed about going in that grocery store, standing in a line, fighting people with buggies, anxiety through the roof. Like, I'm tired, I gotta get ready to go to work. Like, no, I'd rather have my stuff just delivered. So outsource it. Be high maintenance to be low maintenance. Okay, my next tip is going to be keep learning. If you keep learning, it will change your perspective. I was getting burnout towards the end of nursing, and luckily for me, I was transitioning to become a nurse practitioner. So as I'm learning the nurse practitioner role, I'm going to clinicals, I'm working in the same unit. But on my clinical days, I'm excited, I'm pumped up, I'm up early, I'm ready to go. I'm like uniformed iron, like ready to go to work. You know why? Because I was learning. So find something that you're interested in and learn. If you want to start doing lactation, or you want to do education, you want to be the charge nurse, focus on something else that you can learn Because if you're focused on that, you'll find the joy back in your job. Maybe you just need time to step away from bedside, you know? Bedside, you might just need a break from bedside. So try a different skill, learn something new. I promise you, it will make a difference. Now when I go to work, do I have burnout? No, because I love my job and I'm excited to go. I'm excited to learn new stuff. I'm like, okay, I'm getting better and better and better, you know? So I'm happy. But yeah, towards the end of nursing, I was ready to go. Like one foot was out the door. After 7 years, it was time. So focus on something that you can shift to. It's nothing like learning a new skill, I'm trying to tell y'all. And finally, if those things don't work for you, maybe it's time for you to take a step back. But if you feel like, you know, I'm just burnt out, I'm depressed, I'm having anxiety about going to work, I'm just sick of it, you have some options besides just quitting right off the bat. What you can do is you can reach out to HR and take leave. You can take a personal leave, or you can take what's called FMLA. I haven't taken FMLA, I've only taken personal leave before, but you just reach out to them and you fill out the paperwork. As far as pay, you know, you talk to HR and kind of see what the pay will look like. For personal leave, I didn't get anything, I didn't get any pay, but I had money saved up and I was able to take off an extended period of time. And then if you're able to get like medical leave, you'll be able to get some part of your salary. So that'll be good. Talk to your therapist about how can you guys coordinate that, because they may need information and paperwork from your doctor in order to give you that medical leave. But take some time off, you know, live for yourself, go to a beach, read a book, take a walk, and just take a couple weeks off. And then if you come back after that and you still feel like I'm just sick of this job, like I can't be a nurse anymore, shift. Because that's the great thing about being a nurse. You don't have to be bedside. You can be anything else, like I just named. You can do clinicals, you can teach, you can do education, you can do IT, like you can shift into anything else. So do that. What I don't want you to do is get stuck at bedside, not being happy to see your patients, not being happy to take care of them, because at the end of the day, it's our responsibility to take care of our patients, and whatever we're going through, we have to leave it at the door because they're in the hospital. So you know, they're going through a lot too. We're there to take care of them, but you take care of yourself, and if you still can't take care of them, go ahead and shift, because it's time. And that's okay too. There's no shame in that. And like I said, all nurses go through burnout. You know, we all understand it. We all know what it looks like. You just have to recognize that for yourself. I wanted to make this video for you guys. I hope it was helpful. If you know a nurse that needs to watch this video, please send it to them. Please leave me a comment below and let me know if it was helpful. Let me know if I can make any other videos for you guys, and I will see you guys next time. Bye. Baby girl, you are so pretty, pretty, pretty.